Hey everybody, it's Dr. D, mom of 3. Thanks so much for joining me again today. I'm so excited to have you with me on the show. I hope you've been checking out some of the new shows that I've had. There's been some pretty excited episodes going on. So definitely if you missed any of them, check us out. Just a couple things before I start with the show. Again, thank you for joining me. Don't forget that this show does not take the place of your physician or your child's physician's advice. It is a medical informational resource. And also feel free to send some comments and topics that you would like me to discuss at any time. You can either email at drmomshow@gmail.com or just hit up some comments at the bottom of the video. And don't forget to subscribe to the Dr. Mom Show at the bottom left link, and don't forget to share the video. And before we go into our topic, again, don't forget to get your copy of Mom, M-O-M, Meditate, Overcome, Motivate, my Dr. D, Mom of 3 devotional, Mother's Devotional, to help you realize what an awesome mom you are and the promises that we have, that God has promised us of just being strong women, abled women, bright women, favored women, beautiful women. And also I'm super excited about my first children's book called The Tripsies and Me. The ebook is available for purchase on Amazon.com. You can purchase the hard copy. I should say, let me rewind. You can pre-order the hard copy on my website, www.DaleneMuchalak.com. And definitely get that. I'm super excited because it has become an international bestseller. Whoop whoop. So check it out. All right. Well, our topic today is about breastfeeding. Yes. So see, this topic is for both men and women because men love boobs. And of course, women, we have boobs. So, and breastfeeding is something that the majority of women look forward to. Why I'm talking about this, a couple of reasons, because it's an important topic. And second of all, it is also National Breastfeeding Month. That's right, August. By the way, it's my birthday month. Whoop, whoop. Happy birthday to Dr. D. All right. So let's delve right into our topic. So breastfeeding. So what is breastfeeding? So we all know what breastfeeding is. So pretty much that's when a mom, and we see animals do it, mammals, and humans do it, where pretty much after you deliver a baby, your hormones, the way it works, knows that you delivered the baby because that's how God made us. And we get milk that comes out of our breasts, specifically the nipple. And the same way as far as mammals, how it works as far as cows, goats, dogs, horses, you know, all that good stuff. So all those animals are getting milk, or breastfed, I should say. One amazing thing about breastfeeding for mom is that it is such an awesome bonding time. What is insane about breastfeeding is that babies can recognize the smell of that breast milk. How insane is that? How amazing is that? So babies will know if dad is holding onto them and they are hungry. They are not going to be happy on it until they're next to mama's boob, where they can smell that breast milk. And as women who have breastfed, you know, sometimes a baby's cry can even trigger the letdown. Some moms will have express milk when they hear their child cry. Sometimes they'll express milk even if they hear another child cry. But it's so insane how it triggers it. It's just an amazing way that the body works. So that's definitely one benefit. Other benefits, of course, because we get to bond with our babies and hold them close and they have no choice at that point, is nutrition. The reason we breastfeed is because of nutrition. And part of that is, you know, as adults, we've already gotten a lot of nutrition compared to what the babies have had. So it kind of proceeds from in the womb, the baby gets their nutrition from mama again, from the placenta. And when they come out, you want to do a continuum where baby continues to get that nutrition with their breast milk. An amazing thing about breastfeeding is that it is for free. Yes, who doesn't like something for free? I know this girl likes free stuff. So free it can save you a lot of money. So instead of buying formula, which is really expensive if you don't have kids, go and look in the formula aisle and you will see that formula is very, very expensive. And they have different kinds of formula, different brand names. They also have different ones like powder, and then they also have the ones that are pre-made. The pre-made ones obviously are more convenient, but at the same time are even more expensive. The other benefit that breastfeeding offers is immune system protection. So studies have shown that babies who have been breastfed have a decreased risk of having allergies, having things like an ear infection, having things like colds and things like that. They've done studies that show that when these babies go into daycare, which we know is a germ factory, they have a less likelihood of becoming sick as often as their counterparts who didn't breastfeed. Now, hear what I'm saying. I'm not saying that your child won't become sick and they'll just have the immune system of Superman. That's not what I'm saying. They just usually, again, nothing in this world is textbook or black and white, but usually they do not get as sick as their counterparts. So that's really good. And then most of all, this is survival. I mean, when you're hungry and you gotta eat, because that's how I feel. Now, one thing is that it's a great number. About 80% of moms who have babies initiate breastfeeding. Now, what becomes tough is, do you keep up the breastfeeding? So one thing I want to say is that every woman's body is very different. So there's some people who have milk supply for a year, 2 years. Some people will breastfeed their kids up to 2 years. Some people will do everything correct. Get the baby on the breast, do what we call skin to skin contact, and do it all the time, continuous, and their milk will dry up at like 2 months or in a couple of weeks, or their milk supply isn't a ton. So everybody is very different. There are a couple of things like natural things, medication that could help. And again, if you are having issues with lactation, you can always talk to either your OBGYN or if you know a lactation consultant. Normally that's somebody who specializes exclusively in helping moms breastfeed, to help you with like things like positioning and all that fun stuff. Yes, there is positioning in breastfeeding. So every baby does not like to be positioned the same way. So we're always used to seeing a mama just holding her baby in front of her and having the baby breastfeed, but there are a lot of different positions like side laying, where mama's laying on the bed and the baby's right next to the breast, breastfeeding, or football hole, as you got them boop boop in there. And of course, when you have multiples, you gotta double hand that and double breastfeed. So I know all about that. There was 3 of them too. So there was a little rotation system going on when they were younger. So again, get help, get support. There's help out there. What's nice is breastfeeding is something that you can talk about even when you're pregnant. So you don't have to wait until you have your baby and then you're like, oh my gosh, what am I supposed to do? Obviously, it's nice to have that hands-on experience, but you can start speaking to a lactation consultant or speaking to your OBGYN about what are the best ways to get prepared. Like, what do you need? You need a pump. You need a breastfeeding pillow for a little support. Just different things, you know, easy bras. Now they have these awesome bras that where just boop, little snip comes down. You can breastfeed instead of having to take your strap off and all this crazy stuff. And there's nothing wrong with that, but they have just a lot more convenient things now. Now, before we move on, we're going to check out our Tripsy clip of my babies who are getting so big. Check this out.
To you, happy birthday to you, happy birthday to Bobby, happy birthday to you. Yay!
All right, aren't they so cute? They are so adorable. I love them, love them, love them. All right, so back to our breastfeeding. If you're just joining us, we are talking about breastfeeding because August is National Breastfeeding Month. Whoop whoop. All right, so going into, we just finished talking about different ways that you can get prepared to breastfeed by talking to your physician, OBGYN, a lactation consultant, kind of getting through a list of any supplies that you'll need. Now, the good thing is more and more people are becoming more accepting to breastfeeding. I'm not sure why people aren't accepting the breastfeeding. I mean, women have breasts. Breasts produce milk after you have a baby, and then you feed your baby with your breast milk. That seems pretty simple, doesn't it? But what's funny is if you go on like YouTube and you check out, there's a video about this mom who's breastfeeding, and she's not being like out there or anything. You know, she's got a little rag cover or swaddle, whatever, breastfeeding her baby, and they juxtapose that image with other women who pretty much are wearing clothes that expose their breasts, and they're not breastfeeding. But it's insane to see the responses of people, like people saying, ooh, that's gross, to the woman who's breastfeeding, but they're passing by and gawking the lady who has her boobs hanging out, and that's just because of her clothes. She's not trying to keep a baby alive or anything, not giving nutrients to anybody. So I think that's something with time society will need to work on, that, you know, this is a way that babies, this is survival of our race pretty much. And the good thing is more and more places are becoming more accepting and are making things more convenient for moms who breastfeed. So in the airports now, they have little private areas that moms can go and breastfeed their baby or babies. A lot of jobs now are starting to have what's called a breastfeeding room or a breastfeeding break room. Some places are even offering breastfeeding breaks because they are aware that the mom needs to pump. Because that is one thing, the less you breastfeed or pump, your milk will dry up. So more and more places are becoming aware of the need and just how it's convenient to have a place to go instead of being like, I need to breastfeed and you're just out in the open. Funny story, I had a good friend of mine, she's a very good friend of mine, she's also a physician, but when we were in our training, I remember she had her baby and we worked at a clinic on a Saturday, so it wasn't crazy busy. So when we were done and we were doing our notes and dictating, she was like, I gotta go, you know, pump. So she goes into a room and I hear her pump just going like, ooga, ooga, ooga. And it was hilarious because she was also dictating her note on the phone. So afterwards we were both just cracking up because we're like, the transcription is who's going to type out your note is going to say, what is that noise that's in the background? Needless to say, they would never know that it was her breast pump that was making all that noise. So yeah, so definitely ask your job about what they provide in order to, if you are pregnant or you do have a baby and you're breastfeeding, if they do have a safe setting like that, that's exclusive and nobody's going to see you and it's private. Now, a couple of things. Breastfeeding, again, is very different, as I mentioned, for different people. One, everybody's hormones are different. Two, everybody's body's makeup's different. So again, I just want to encourage you, don't become discouraged. I always say to moms, you know, you can only do your best. So if you really want to breastfeed, you know, go ahead, try it, do it, and then the body, pretty much nature takes it from there. So don't get discouraged if you breastfeed for 4 months or if you breastfeed for 6 months or if you breastfeed for a year. You should be proud of yourself no matter how long you breastfed. Now with breastfeeding, again, as I mentioned before, those are nutrients that are coming directly from mom that are going to baby. So a couple things you need to keep in mind, and of course your physician or OBGYN will talk to moms about this, that moms, if you have certain infections, that may stop you from breastfeeding your baby, or if mom, you're on a medication that could go through your breast milk and be harmful to the baby. So there are some exceptions where, you know, we have to ask mom to stop breastfeeding in those situations, so that gets a little tricky. Sometimes babies also have some issues if a child is born with any issues with their mouth. So for example, if a baby is tongue-tied pretty badly, not every tongue-tied baby necessarily has issues breastfeeding, but sometimes when a baby is tongue-tied, they can have issues latching onto the nipple, and that's just because they can't stick their tongue out all the way because it's tied. That's why it's called tongue-tied. Another thing too is if they have any, again, just mouth disorders. So if they have like a cleft palate, cleft lip, obviously they can't do that. And sometimes breastfeeding is also delayed if a baby is born and they're having any breathing or respiratory issues. If they're breathing fast, we don't allow them to breastfeed at that point, because then they can choke and can go into their lung, they can get pneumonia. Just a lot of bad things can happen. Or if the baby has any infection that puts them at higher risk, they may not be able to breastfeed as soon as they're born. So there's a lot of different things that go into play when we do talk about breastfeeding. Again, as I mentioned, I feel like as a society, people are becoming more accepting to breastfeeding. People are seeing the great things and the positive factors and the benefits of breastfeeding. So we definitely want to encourage that. Moms, there's also resources, or if you just want to read, there's resources online. You can check out the CDC's website or the Center of Disease Control. Also healthychildren.org, that is great. That is ran by the American Academy of Pediatrics. That they do a whole bunch of topics, you know, it's not exclusive to breastfeeding. So it is very important. So definitely check that out. Also if you have a baby, you know, and you're breastfeeding, congratulations. If you breastfed them, congratulations. Even if you're not breastfeeding, congratulations, because I know you're being a good mama. So have a great day. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers goodnight. Don't forget to hit the subscribe button on the screen on your lower right hand side. Don't forget to share the video. I'll see you next week. Bye-bye.